So it's your girl, Fit Nurse P, coming to you with this cultural diversity campaign. Here I have some of my dear friends, and we just kind of want to share some of the experiences that we've dealt with in a lack of cultural diversity, being in healthcare and being of, I guess, different ethnicities. We've kind of experienced some different things, so we want to shed light on that and share how you can grow from that and how you can become more culturally diverse so that you're not only promoting cohesiveness between your coworkers, but also providing better patient care for those who are different than you. And also stepping outside of your zone. And I think my biggest thing when I think about cultural diversity is just seeing other people the way God sees you, or loving other people the way God loves you, no matter your race, ethnicity, color, sexual orientation, gender, religion, etc.
Hi, my name is Kayla, and I am a registered nurse. I've been practicing nursing now for the past 2 years. I work in the neonatal ICU, and I love it, and there's definitely some things to share about the cultural diversity that occurs in the healthcare workplace amongst nurses.
Or a lack of. So like I said, I am Precious. I have various amounts of experience, trauma ICU, pediatric ICU, now neonatal ICU, so a couple different things. And I have been a nurse for 3.5, going on 4 years. Mike.
My name is Mike. I've been a nurse for 6 years. My specialty is critical care and ER. And my Instagram handle is official, Murse Mike. That's MURSE MIKE.
My name is Geremy, aka Abdi_QUB. I've been a critical care nurse now for about 9 years now. So I think I'm like an old guy here.
Yeah.
But yeah, so it's a lot to talk about, as mentioned, about cultural diversity in nursing, and we're here to share it with you guys. So stay tuned.
Share a little bit on my experience. Being in critical care, it seems that there's not many African Americans, so I did experience working at a place where there was Confederate flags in the break room, so I had to sit there and look at it every day. I will say that I was fortunate enough to grow up very diverse. My mother was in the military for 22 years. I have cousins, aunts, uncles that are different ethnicities and races from me. So it hurt me for somebody to ask me that, or to see those things like the Confederate flag. It just really hurt me in the workplace. So for me to broadcast these things or to say something so negative when you don't even know who I am, I just feel like that's hurtful. And that's where we can make some improvements with cultural diversity, is learning other cultures and learning about other people so that you're not so offensive, basically.
I absolutely agree. I did a travel nurse experience up in New York City for about 3 years, and originally I'm from Georgia, I'm from the South, so really all my patient clientele was either black, white, or a mix in between.
Right.
So we really didn't have a lot of cultural diversity. I wasn't exposed to a lot of cultures like that, but when I went to New York, I mean, from my coworkers to my patient population, everybody was just so diverse, and I was just opened up to a plethora of experiences. I actually took care of a Holocaust survivor, which was probably one of the coolest things I've ever experienced. Learned so much from her and her family, and just, from experiences that they shared with me. And one thing that I did notice is that cultural sensitivity tends to be kind of regionally divided, for whatever reason. But I think, as you mentioned, if we just all kind of open ourselves up to new experiences, new people, and realize everybody's different, and God made us different for a reason, and we can learn from one another, and we can really benefit from that learning and learn to just live cohesively and be one unified people.
Yes. Yes. And I just want to add to that. I truly believe that when you're culturally diverse, you can provide the best patient care, because not your patients are not going to look like you. Your patients are not going to be the same culture as you. So if you understand and have a more broad knowledge of different cultures, you're effectively taking care of your patient because you can understand them. How many patients do y'all know have not spoken up because culturally that's not what they do, or there's a language barrier, and we didn't take it upon ourselves to get that interpreter or go the extra mile to really understand where they were coming from to best fit their needs as a patient. That's important as healthcare providers, and I think we could do a lot better for the patients and our coworkers.
So basically, my tip to people who are having a hard time becoming or accepting other cultures and different ways of thinking, I think basically what you have to do is look on the inside and realize that everybody, no matter what the gender, age, color, anything, you just have to realize that we're all the same on the inside. So once you can get past that, then outside of that, it's just really accepting the practices and being aware of the practices and learning how to cope and kind of move with those.
And just to piggyback off what he said and to add to learning how to be more culturally diverse, a lot of people don't know that they lack cultural diversity. So look around your circle. Do you have people that don't look like you surrounded by you? Do you know other people that aren't your same color or from different places, different countries? If your answer is no, I don't, then that's a lack of cultural diversity. And you may not even know it. You may not be racist or prejudiced or whatever you want to call it, but you lack cultural diversity.
Hi, I'm Abdi. I'm a second-year med student at MCG.
Tell them your background though.
Oh, but I'm a respiratory therapist for about 4 years.
Yes, yes.
Yeah, ongoing now. So, the late Dr. Francis, one of my friends at the medical school, taught us about culture competency. One thing we do talk about is we use this model called the ASK model. The A stands for awareness. You gotta be aware of your prejudices. And this is for people who are trying to learn about other cultures. So you be aware of your prejudices, understand that you have some kind of deficiency, maybe. And then also S. The part of S is skill. You have to have a skill. You know, take your chance. You know, learn. Go out and learn what's out there for you. And these things take time. You can't just one day know everything. K is knowledge. There is information out there to learn about other cultures and you know, whatever's out there. E is encounters. In order to actually learn, you have to encounter these kind of patients. That kind of adds a skill set to what we're trying to do. And then D is desire. You have to have the motivation to be able to actually do these things. You can't just help this passively learn by watching TV and believing what you see in the media. So, yeah.
So just to add something just a little extra about cultural sensitivity in the workplace, I would just say as healthcare workers, we definitely need to be mindful of each other and to judge each other based off of our skills and qualifications and not based off of culture or our preconceived notions of what someone's background is. A lot of times people aren't given equal opportunities in the workplace to show their skills, to demonstrate what they're capable of doing just simply based off of their skin color. We need to be more aware.
Thank y'all so much for tuning in and watching this video. I truly hope you learned something from it. If this is something that you think that you can work on, please, you can hit me up in my Fitness P Instagram DM and we can talk about it. I'm so for open dialogue because it means so much to me. I want everybody, and I feel like everybody in this world, every patient, every coworker, every individual, no matter who you like, what color your skin is, who you believe in, I feel like we should all be able to come together. Thank you for